Hey everyone, it's Gordon here, and you're listening to yet another episode of the Public Health Insight Podcast. If you've been a fan for a while, thank you for always tuning in and listening. And we want to make sure we do a better job of letting you know how you can reach out to us, how you can share your thoughts, how you can tell us about what you liked and what you didn't like about the episodes that we've published so far. So in this episode, I'll also talk about some ways that you could do that. If you have any thoughts, any feedback to share, or any suggestions about the types of things that you want to hear on the podcast. So we'll go through those as well. And when I say me, I'm used to having a co-host, but it's me today. Without further ado, let's crack on. You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. In 2023, the Public Health Agency of Canada commissioned the National Collaborating Centers for Public Health in Canada. There are 6 of them, and they commissioned them to consult the public health community to update the 1.0 version of their core competencies for public health practice. And that version was published back in 2008 and hasn't been updated since. In that original version, it outlined 36 core competency statements across 7 categories, and essentially that reflects the essential knowledge, skills, and attitudes necessary for public health practice. Now, as part of this new process to revise, modernize, and revamp those initial core competency statements, there's a series of consultations and engagements with the broader public health community. And a key part of this work this time around is they're also looking into exploring what type of oversight, what type of governance needs to be put in place to ensure that the core competencies that they develop this time keeps in mind the current needs and priorities of the current public health system. Now, the reason I'm talking about all of this is because I want to ask you the question, are core competencies in public health even a useful thing? Is this something that you use in your public health practice as an individual? Is it something that you use as an organization in any way at all? How useful is it for us to go through this process of trying to standardize core competencies for public health practice? It looks good on paper, and it's a good way to think through the different skills and competencies and the different domains that a public health professional might be expected to be competent in. But beyond the development of these tools and these resources, does it really get used after the fact? So that's something I want to explore, and that's at the heart of this discussion. Before I move on, I just want to let you know about this cool feature that Spotify has for you to get in touch with us. So Spotify now allows you to comment on individual episodes that we put out on the Spotify platform. Those comments come through to us. We get notified. We see them. We can see who makes a comment. And that's our way to engage with you, to learn about what you liked about the episode, maybe what you didn't like, and some of the perspectives that you want to bring to the conversation. And we're committed to making a concerted effort to give you a little bit of a shout out on the next episode for the best comments that come in. So please use that feature. Let us know what you think in the comments. Now back to the process that the Public Health Agency of Canada and the National Collaborating Centers for Public Health are undertaking. This would be the first time in more than 15 years since the core competencies have been updated. Now, in the US, there's one that's recently been updated, and it's a different governance body, and it's the Core Components for Public Health Professionals. That one was published in 2021, and it was developed by the Council on Linkages between Academia and Public Health Practice in the US. Canada has their own set of core competencies, though I expect that there might be significant overlap between the two, and there might be other countries as well that follow a similar process of trying to standardize what a skill set might look like in public health for effective practice. As part of this work, they mention consulting with the broader public health community. Now, in our work, we define public health so broad to include pretty much everything from infrastructure, housing, to the animal health sector, to agriculture, and all these domains cutting across the traditional public health industry. Now, when we define public health so broad, how do we not get into trouble when we're trying to standardize the skill sets? If we focus too much on those niche skills, knowledge, and experiences, does it kind of get in the way of us coming up with a standard set of competencies that are useful to public health practice in general without getting too ultra specific? That's something that I've always wondered about. The other component of this, as far as how this work has been progressing, part of this plan included consulting with public health professionals, quote unquote, decision and policymakers, as well as educators, researchers, and health influencing community organizations, which can mean pretty much every organization that's out there. But I imagine that there are some specific ones that would tend to champion public health work, even if they don't really call it as such. The other component of building core competencies in an inclusive way is not forgetting about the diverse experiences of people, whether it's lived experience or the backgrounds that people grow up in. And in the plan for this work to build and to modernize these core competencies, they identified Black, Indigenous, Francophone public health partners. And the reason they cited is that by doing so in this process, it prevents the further perpetuation of injustices and inequities, to making sure that the different voices that need to be captured are done so, and are done so in a purposeful and active way. Now, doing all of this work, so there's years and years and years of work, and many people that are involved in this project to take the 2008 Core Competencies from the Public Health Agency of Canada and to look at modernizing those into the new world of public health. After all, since they were developed more than 15 years ago, there's been the H1N1 pandemic, the Ebola outbreaks, COVID-19, more climate disasters, the rise of social media, the importance of digital marketing, how health promotion has evolved in the new era, and lots of different things, and the emergence of chronic diseases and the different types, and how the different systems in public health that we now work in with funding constraints and the political pressures. And an astute public health professional is expected to be able to respond to all these different external factors. Now, again, the question becomes, is this useful work to undertake? So beyond developing the core competencies, beyond the 10 minutes it might take you to read them, are they used beyond that? And that's a question I want to dive into. As far as the 2008 core competencies, I can speak from personal experience that these are some of the things that I actually saw on job postings for positions that I've been applying for. And the way it would look is, instead of listing a bunch of random tasks that you're expected to complete, the different responsibilities of the position that you're pursuing, they organize them by the domains within the core competency statements. So then whether it's public health sciences, whether it's program evaluation, whether it's advocacy and leadership, the tasks were all categorized under those domains. And I thought that was a very useful way to think about what I would be expected to bring to the role that I'm applying for. The other part of it too that I've seen it used is in the application process. So sometimes when you apply for a job, you go on a web page and you're filling out your name, your information, you're uploading your resume, and there's different sections sometimes where you have to actually respond to different prompts or questions. And essentially, some of the postings that I've applied for, I've had to describe how my experience and knowledge aligns with those core competencies. So if it's public health science, I would have to describe something from a previous role that I did that signifies that I'm competent in that area. And that's a tool that the employer then uses to assess your fit for the position. So already you can see in the context of like a workforce development situation where employers are actively using the core competencies to make sure they bring in the right candidate to match the position that they're recruiting for. So in that sense, you do see organizations using it to their advantage to ensure that they find the right person. The other important piece of this too is when a public health core competency framework, for example, is standardized and is regularly updated to meet the current needs of where public health is going and the emergent needs, it informs the development of education programs and training, whether it's through formal education and graduate public health programs and certifications, or it's through independent training that is offered by a provider and making sure that there's a standard set of criteria to aspire to, as well as your own professional development. So that's where I'm kind of getting at. How often do you as a public health professional reflect on your growth as it relates to the core competencies of public health practice? How often do you go and look at the list and say, how competent am I in the area of advocacy? How competent am I in the area of leadership? How competent am I in the public health sciences? How competent am I in research and knowledge translation and communication? How competent am I in those areas? And if so, is there a standard scoring system? Because is it either you're competent or you're not? Is there something in between? So that's something I never really fully grasped myself on. And as someone who has been taught to continuously strive and have big ambitions, I always feel that I can never say that I'm truly competent in something. So in the end, if you're kind of looking at it from that perspective, maybe you never reach competence in any of those areas, but at least it lets you know to be effective, those are some areas that you have to be actively skill building in. Anyways, I just wanted to share some thoughts about core competencies. A lot of people like them. A lot of people maybe don't care for them, but I wanted to hear your thoughts after sharing mine. And the way for you to let me know what you think is one cool feature now on Spotify. You can actually comment on a specific episode. So when this episode comes out, you can actually type out what you think about what I said. If you agree with it, if you have a different opinion, I would love to shout you out on the next episode. We have a very engaged community of public health practitioners, aspiring public health practitioners as well. And I would love to showcase some of your thoughts and to see if it resonates with other people in our community. So please use the Spotify feature if you listen on Spotify to comment on this specific episode where we're talking about our core components for public health practice actually useful beyond the development of them. And I'd be happy to hear your thoughts. That's enough for me rambling on for now. Until next time, peace. This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.